At Midlands Dental, we actually do restore implants. Currently we're not placing them, but we do put crowns on them in the end. Once the implant is actually integrated into the bone, you'll actually come to see us, and at that point there will be a healing cap in place. It depends on where the implant is, however, as to whether or not there's a healing cap. In the front, we can actually put temporary crowns on so that no one will ever know that you're missing a tooth. That's one of the advantages we have with implants. But if it's in the posterior, a lot of times there will be something, this little dome-shaped piece called a healing cap. What it does is it helps shape the gum so that whenever we actually put the implant in and the crown on, that it looks natural. It comes out with a good emergence, so no one knows it's a fake tooth. But that'll come in. You'll come in and see us like that. And the next appointment, or first appointment we'd actually have with us, would be to take an impression of the implant so that the lab will actually be able to make it for you. At that point, you come in. You don't have to be numb for this. We'd ease in and take off the healing cap. Like I say, it looks kind of like a mushroom. We take that off. The surgeon would send us an impression post, which looks like that. So we go in and we would screw that down into the implant itself. And again, this is a metal to metal connection, so it's not going to hurt. You may feel a little bit of tightness around your gums, but it's not going to be painful at all. We'd place this. At that point, we take an impression of this in your mouth, just like we do for crowns. We just put some impression material around it, seat the tray. It would set up. We would take that out at the end, and all that goes to the lab. The impression, this little post, and everything goes to the lab to fabricate your implant. So we take that out, and then you'd leave that day once again with the healing cap in, or little dome. So we'd reseat that and you'd be gone. About 4 weeks later, you come back to us. At that point, the lab has fabricated a crown for you. They'll actually use a stock abutment like this. Sometimes we have to use a custom abutment, it just depends. It goes in on top of the implant. And we tighten that down and put it to place. We check the fit of the crown, make sure everything feels right, make sure your bite's right, make sure it's tight and we have good contact between. It goes on top. Then after we've done that, we torque this down. Use a special wrench to tighten the implant down to make sure it doesn't back out on you whenever it's in place, so that it stays in place for the entirety of the life of the restoration. So we tighten that down and it will break over. It does kind of feel awkward in your mouth, but it's not too bad. No pain there. Take that out, and then we cement your crown on top. At that point, of course, we would have checked your bite and all so that we know everything's right. Cement that down, and guess what? You've got a tooth that nobody knows is there where you didn't have one before. Dental magic.